Hi everyone, I'm Mike Hermus, CEO of Halespring. I'm a two-time software company founder and the former Chief Technology Officer of the U.S. Department of Homeland Security. But more importantly, I'm the close family member of a young person who struggled with significant mental health challenges for the last 6 years. In our journey, we learned that there are so many excellent mental health providers out there, but significant parts of the ecosystem are broken. Right now, every day, people struggle to find the appropriate mental health care for their situation, especially if they have complex needs. Every day, therapists, psychiatrists, counselors, and others team up to help their patients, but they struggle to communicate or collaborate because they lack a HIPAA-compliant way to do so. Right now, every day, patients and their families need to communicate critical information to those care providers, but they find themselves at the center of a tangled web of texts, emails, and phone calls, a stressful and highly ineffective system. All these things lead to worse patient care, and that ultimately can lead to worse patient outcomes. And that is why we built Halespring. Our easy-to-use HIPAA-compliant software platform is designed to make life easier for healthcare providers and for patients and families. Let's hear from Dr. Josh Eudowe, our Chief Clinical Advisor and experienced mental health professional, to share his perspective.
Thanks, Mike. I've been a mental health professional for over 10 years with a master's degree in forensic psychology and a doctorate in clinical psychology. I've worked in psychiatric inpatient hospital units, community agencies, and in private practice where I specialize in high-risk child and adolescent cases. Being on the front lines of this mental health crisis, we absolutely need the tools that Halespring provides. Just as an example, referring patients to other providers is something we do often, but the process is awful and inefficient. Because of very strict HIPAA regulations, we send out emails with limited information to groups of our colleagues, or we post something vague on social media. This process takes time waiting for a response, and meanwhile, patients go without care. Halespring fixes this. It's developed a unique referral system that allows the provider to search a database for patients that align with their area of specialization and individual approach. And because the platform is HIPAA compliant, providers can share far more clinical data, ensuring a much better patient-provider fit, which is widely known to improve patient outcome. Another incredible feature we need is the team collaboration tool. As an outpatient provider, I need to share documentation and communicate often with other professionals across areas of practice. This gives my patients the most comprehensive care and best chance for effective treatment. Unfortunately, as Mike mentioned, that means emailing documents, leaving voicemails, and texting. It's inefficient and, once again, limited by the lack of HIPAA compliance. Using Halespring, providers can safely share documents and clinical information. We can communicate with specific people or the entire care team in real time through chat and even video. This makes collaboration so much more efficient and, again, improves patient care. These tools, along with Halespring's professional community, will make a huge difference in the way we practice.
Thanks, Josh. Now let me talk a little bit about the nuts and bolts of the business to give you a better sense of the opportunity. At core, we're a technology company. Our flagship product is the Halespring software, which will be offered as a service, otherwise known as SaaS. We'll have a free forever account tier with valuable features like professional profile and networking, all tailored for the mental health provider. We'll have other premium features that will require a paid monthly subscription, like the robust collaboration tools and unlimited referral searching. In our research, we've talked to hundreds of licensed mental health professionals, and the enthusiasm has been overwhelming. In our most recent survey, 97% indicated they want to use a platform like Halespring, and 2 out of 3 said they'd be willing to pay for it. It's important to understand that right now, Halespring is real software that's been in development for over a year. It's going to soon be ready for customer use. We're built on a rock-solid foundation of modern technology and cloud infrastructure, and privacy, resilience, and security have all been in focus from day one, especially critical for our HIPAA compliance. If you care about investing in strong companies that can build a successful business, then I think you're in the right place. Our team has deep expertise in building software companies, and we understand this domain intimately. But if you also care about making a difference, about improving the lives of others, then I urge you to consider investing in Halespring. Help us help the people on the front lines of the national mental health crisis, and join Halespring to fix what's broken. Thank you.